That's a nice segue into this topic of needing to measure things, I assume. So if you're going to sort of implement a lean system and try to remove waste, if you're going to try to improve quality of care or make a workplace safer or things safer for patients, you want to be able to measure whether you're actually achieving the goals that you're seeking. And that really brings us to this topic of transparency, in healthcare. And I always think kind of an interesting topic because, if we talk about the need for more transparency, presumably we feel, or at least some people feel, we don't have enough to begin with. And so I wanted to get your perspective on that. With all the discussion about transparency and the continued need to sort of drive transparency in healthcare and the measurement that's associated with it, what's your take on this topic?
We cannot advocate transparency enough. It is bringing consumerism to healthcare, which is long overdue. Traditionally, healthcare is far too opaque. Patients get the care that their providers tell them to get without questioning it. They have very little information about the quality of their providers. Bills are paid by third-party payers, and patients are pretty much excluded from the purchasing decision. Well, I think that's changing. I think one of the main reasons why it's changing in the past 5 years or so is the prevalence of high-deductible health plans. Patients now have skin in the game, and they want to be involved in the purchasing decision. We're seeing this thing arise. It's this new generation of consumer that we call the activated patient, the patient that actually wants to be involved with their selection of healthcare services. They want the best for themselves. They want the best for their families. Now, an offshoot of the activated patient, something called the connected patient. We see patients that want to access healthcare information on the internet, the information that they want when they want it. They're applying the same principles they use if they're buying a car or planning a vacation. And I think the thing that healthcare has struggled with is to step up and provide that information for them so that they can actually engage in this kind of consumerism. And we haven't even touched on employers who also need transparency so they can provide the most cost-effective care for their workforces.